is Ayano. Today I'm doing BME 203 head to toe assessment, and I'm gonna start by scanning the room. Okay, I'm gonna sanitize my hand. I'm gonna wipe disinfect my stethoscope. Go to my client, provide privacy. Hello, my name is Ayano. Today I'm gonna be a student nurse. Is that okay with you?
Yes.
Okay. Can you tell me your age, your name, your birth date?
My name is Mahmoud. I'm 20 years old. I'm born in 2000.
Can you tell me today's date and where you are?
Today is November 30th, and I'm in the clinic.
Okay, let me check it. Okay, that's correct. So before we begin, would you like to empty your bladder?
No, thank you.
Okay, so I'm gonna start with the general survey. His age looks stated a little bit younger than stated age, and his skin tone is consistent. His height is with normal limits with his age and generic heritage. His weight is with normal limits with his height and body build. His posture is symmetrical. His position, he sits comfortable. His facial expression is relaxed. His mood is comfortable. He maintains eye contact. His speech is clear and understandable. Can you take a few steps for me, please? Okay, his gait is well balanced and coordinated movement. His range of motion is full mobility with each joint. His level of conscious is alert oriented ×3, and there is no walk of breathing or distress in his breathing. And now I'm gonna move to the head. The hair size is medium, well proportionate to the rest of the body. The shape is round. There is no deformity, and the hair color is black, well distributed. And now I'm gonna palpate, so I'm gonna pretend I wear glasses. Okay, there's no masses, there's no lumps, there's no nodules in the hair. Do you feel any pain?
No.
There's no pain, tenderness, and there's no swelling. And now I'm gonna move on to the face. The face is symmetrical, the color is consistent, there's no scars or lesions. And now I'm gonna check cranial nerve 7. Can you please smile for me? Can you frown? Can you puff out your cheeks? Can you show me your teeth? Can you raise your eyebrows? Can you close your eyes tightly? So cranial nerve 7 is intact. So now I'm gonna move on his eyes. So the eye color is brown, the sclera is white, the eyelashes are evenly distributed, there's no lid lag, and there's no discharge. The conjunctiva is pink, and now I'm gonna measure the pupils. Okay, the pupils are 3 millimeter. They are equal in size. The shape is round, and now I'm gonna start doing the direct and consensual light. Now I'm gonna shine light on your eye and breathe. Okay. Okay, so when I shine light on one eye, the other eye constrict as well. And now I'm gonna do the accommodation. Please, I want you to stare at my finger. Okay, so when I do the accommodation, both eyes constrict and converge at the axis. And now I'm gonna move on to the ears. Okay, both ears are symmetrical, the color is consistent, there's no discharge. And now I'm gonna palpate the auricles and the tragus. Tell me if you feel any pain. Any pain?
No.
Okay, there's no pain. And now I'm gonna do the hearing test. Okay, cover that ear. Black, couch, full.
Black couch room.
Okay, do the same thing to the other ear.
Black couch room.
Oh, sorry.
Dolphin, ocean, fish.
Okay, and now I'm gonna move on to the nose. The nose is midline. The flaring are symmetrical. There's no discharge. And now I'm gonna palpate the frontal and the maxillary sinuses. There should be slight pressure, but not more than right. Do you feel pain?
No.
Okay, so there's no pain. And now I'm gonna move on to the mouth. So as I start, the lips are symmetrical. They look well hydrated. Can you open your mouth? Can you show me your gum? Okay, there's no swelling or bleeding on the gum. Can you show me your teeth? Yeah. All teeth are present. There's no dental decay. There's no, dental caries or loose teeth. Okay, the soft and the hard palate are in color in pink, and the structure is intact. And the tongue is well hydrated as well, and it's pink in color. Can you touch your tongue to Ruth? So the bottom of the tongue is symmetrical, and there's no lesions. And now I'm gonna check glossopharyngeal and vagus nerve. Can you stick out your tongue? Okay, can you say ah? So when the patient says ah, soft bleed and ovular rise. And now I'm gonna check a hypoglossal nerve. So I'm gonna ask you to put your tongue in midline. Can you move to that side? To this side? Can you say light, tight, dynamite?
Light, tight, dynamite.
So when the patient says light, tight, dynamite, there's no tremor, and the tongue is midline. And now I'm gonna move to the neck. So as I inspected the neck, the color is consistent, there's no lesions, and there's no scars, and it's symmetrical. And now as I palpate, the temperature is warm and moist. There's no swelling. Do you feel any pain?
No.
There's no pain, and there's no obvious enlargement of the thyroid. And now I'm gonna palpate the carotid artery, one at a time. So the rhythm is regular, and the rhythm is regular, and the rate is 76 per minute, which is normal, and the grade is 2+, and they are both symmetrical bilateral. So now I'm gonna move to the arms. Can you show me your arms? I'm gonna sit, put your legs down, sit down. Okay, both arms are symmetrical, the color is consistent, the hair is evenly distributed, and there's no deformity. And as I palpate, the temperature is nice and warm. Joint temperature is warm. There's no masses. There's no lesions. There's no scars. Do you feel any pain?
No.
There's no pain or swelling. And now I'm gonna ask you to grip my. I'm gonna check the finger grip. Okay. The grip is strong and it's bilaterally symmetrical. And now I'm gonna check the nails. The nail color is pink, and the shape is round. And the capillary refill is under 3 seconds, which is normal. And now I'm gonna check the range of movement of the upper extremities for crepitus and pain. So can you please extend and flex your fingers? Can you extend and flex your wrists? Can you do ulnar radial deviation? Can you do extend and flex your wrist? Can you do supination and pronation? Can you abduct your arms? Can you abduct your arms? Can you do external rotation? Can you do internal rotation? Okay. Can you shrug your shoulders? Okay, so as I was palpating the neck, I forgot to check spinal accessory nerve. I'm gonna check it now. Can you push your face against the arm? Okay, the other one. Okay, shrug your shoulders. So spinal accessory nerve is intact. And now I'm gonna move on to the lower extremity. Can you please lie down this way for me? Maybe this way with your legs forward. Move a little bit as you feel comfortable. Okay, move a little bit. Okay, full legs are symmetrical, the color is consistent, the hair is evenly distributed, and as I palpate, the temperature is nice and warm, and there's no calf pain, and there's no deformity, no lesions, no scars. And now I'm gonna check the feet. So can you please, I'm gonna check the dorsiflexion and plantar flexion. So can you do your like this? Can you do this? Okay, so this, can you do yourself this and this? Okay, so they are strong, the strength is strong, and they are bilaterally. And now I'm gonna palpate posterior tibial artery, tibial pulse. Okay, so the posterior tibial pulse is, the rhythm is 75 as well, and the quality is regular, and the quality is good bilaterally, and I will grade it 2+. And now I'm gonna palpate the dorsibedis pulse. Okay, they are symmetrical bilaterally. The rhythm is regular, and the grade is a little bit weaker than the other pulse, and I will grade it 1+. And now I'm gonna sanitize my hands, and I'm gonna move on to the thoracic. Can you please sit up and show me your back and just check your back? Okay. Yeah, you can do this here, please. So as I'm checking the back, symmetrical, the color is consistent, there's no deformity, there's no lesions or scars, and as I palpate, the skin is warm and moist, there's no swelling, and there's no tender. Do you feel any pain?
No.
There's no pain or tenderness. So now I'm gonna auscultate for lung sound. Okay. Can you breathe in and out as I move my stethoscope one place to other? Okay. So as I auscultate, the bronchial, bronchiovestibular, and vestibular sounds are normal. There's no wheezing or crusting. So now I'm gonna move on to the interior chest. Can you please face me? Okay. So I'm gonna check your pulse again, please, to verify. Now I'm gonna be doing the respiratory rate, the patient not knowing. Okay, the respiratory rate is 18 per minute, which is normal. The rhythm is regular, and the strength is 2+. And now I'm gonna move on to the cardiovascular. So as I move on to the cardiovascular, the aorta valve area is second intercostal space on the right, on the clavicular line. The pulmonic valve area is on the left in the second intercostal space on the clavicular line, and Erbi's point is on the third space on the intercostal space on the clavicular line, and Mistral valve is on the fifth intercostal space on mid-clavicular line, and tricuspid is as well somewhere in the fifth and fourth intercostal space on the sternal bone and below the sternal bone. And you can hear the loudest of S2 at the apex, and I mean at the base of the heart, and you can hear the loudest of S1 at the apex. So now I'm gonna palpate epic pulse for any abnormal heart sounds. I'm gonna palpate first of all the whole heart. Okay, there's no any extra hard sounds, and now I'm gonna palpate the epic pulse. Okay, the pulse is regular, rhythm is regular, and the pulse is 76 per minute, which is normal, and the grade is 2+. And now I'm gonna move on to the abdominal. So can you please lie down? So I'm gonna drape the patient. I'm gonna drape you. Can you go this way, please? So I want to be on his right side. Okay. So as I inspected the belly, the color is consistent, the umbilicus is midline and inverted, the hair is evenly distributed, and it is symmetrical, and there's no scars or lesions, and there's no veinings on the stomach. And now, before I palpate, I'm gonna start by auscultating, starting from the right lower quadrant, which is the loudest. I'm gonna auscultate now for any bowel sounds or normal or abnormal bowel sounds. And I'm gonna go clockwise. Okay, so it's gargling and normal stomach, belly, abdominal bowel sounds, and the bowel sound should be 5 to 30 bowel sounds per minute. In this case, it's regular and it's normal. And now I'm gonna palpate slightly on the tummy. So I'm gonna start the same thing here for superficial masses. So there's no any abnormal superficial masses, and now I'm gonna palpate the bladder for distension. And the bladder is normal, there is no bladder distension. And now I'm gonna ask the patient to dress, and I'm gonna finish, so meet him outside, so bye.